Good afternoon, everyone. My name is Ari Meir. I'm a product manager in Google Cloud Healthcare. My team is focusing on medical imaging solutions. So it's my privilege and pleasure today to host Dr. Kimura, visiting us from Hiroshima, Japan. He and his team are here to tell you a little bit about an interesting company called MNES and their work. So I actually learned about MNES's work from a friend of mine. And one of the things I found especially interesting is that they were able to build a full teleradiology solution, cloud native, so they started from the cloud, and they did it without ever speaking to anyone technical in Google. So they're using AI, they're using a full radiology stack, they build their own viewer, and they have full-time developers, they have full-time radiologists on their team, they will tell you more, but without ever speaking to Google. So that's like one of the examples of how self-service customer. So I would like to start by showing you a quick clip to give you a high-level overview, and then we're going to be discussing different aspects of this work.
広島県が全国で2番目に入院地区が多い都道府県である。検査キットだったら入力我々の専門医がいない地区が多いということで、運動がどちらも用いて医療のこういった地の構造にしてみたいと思ったところになります。本ですが目指すところは事業を重ねていく中で、まさにインフラあるいはこの技術が必要になってきますので、GCP の力を上げてですね。これを展開していきたいというようになりました。プレックは GCP 上にシステムが構築されていますので、インターネット環境さえあれば、医師がどこにいても簡単に遠隔画像診断ができる。仕事に携われなかった子育て中の医師、海外留学中の医師がですね、少しの時間でも診断ができるということがあります。
画像のサイズは20メガ程度、一度に完全サイズ画像が一つだから拡張される。それを3分以内にユーザーに提供しないといけない。アップエンジンとプロバイスエンジンのフルマンネジトがスケールを利用してそこを実現できるというのが利点です。
優秀な医師の知見を集約することで、レベル質の高い診断が行われる、そういう思いを持ってですね、AI の開発に取り組んでおります。有用性が見えてきたものが脳動脈瘤の検査。50% 程度のスティック率だったんですが、この2年余りでですね、85% から 90% といった精度に向上しています。役に立ったのはですね、アップエンジン上に構築したフィードバックシステムになります。過去の能力等々すべて世界中どこでも活用できる。これができるのは Google さんしかないんです。とって非常に有意義なことだろうと今は考えております。
Thank you. So before we move on to the presentation, I would like to suggest you look for the movie stars among, because there are some people near you. But Dr. Kimura, welcome to Cloud Next. It's a pleasure having you here.
Thank you too. It's great to be here.
So tell us a little bit about MNES. What does your company do?
After graduating from university, my first job was a radiologist at a big hospital in Hiroshima. I saw many insufficiencies in clinical practice, which I wanted to address. MNES is a tele-radiologist company based in Hiroshima, providing radiology service to hospitals in Japan.
So what was the problem you were trying to address?
One day, a patient was brought to the hospital. She was 37-year-old with advanced pancreatic cancer. I checked her previous results of medical checkup from 6 months ago. I examined the old CT image, and yes, cancer was there, and it was missed.
So how does this happen? How does one miss a cancer?
The patient had her CT scanned at a small village with limited access to a radiologist. It was a misdiagnosis that could have been prevented. This incident broke my heart and opened my eyes. This is why I started my company, MNES, to focus on tele-radiology and bring expertise where it's most needed.
I see. So in your mind, like, how does teleradiology help here?
Before I explain how teleradiology can help here, let me share with you three dimensions of the challenges. The first dimension is the ratio of number of radiologists to number of images created. The second dimension is geographical uniqueness of Japan as an island nation. And finally, the third dimension is the social uniqueness of Japanese healthcare system.
Interesting. So what do you mean when you say the ratio?
Here's some data on radiology discipline in Japan and US. If you look at the number of CT and MR units in each country, you see that US and Japan are pretty close. But if you look at the number of radiologists, you'll see that USA has 10 times the number of radiologists compared to Japan. When I recently chatted with an American colleague, he was shocked that a non-specialist like an internist can make a radiology interpretation. In the US, once a misdiagnosis happens, it often leads to a malpractice lawsuit. In Japan, the situation is different, and it is far from ideal.
So I understand how this difference drives you to make it more effective. What about geography?
Because of the geographical reason in Japan, we also have a very uneven distribution of doctors. Most of them are concentrated in large urban areas. This makes rural areas very starved for specialist access. My hometown is a perfect example. Hiroshima Prefecture is surrounded by islands and mountainous areas with limited access to specialists. Compare it to the map of California, and you can see how teleradiology or telemedicine become very relevant.
I see. So lots of islands, difficult to access, all the experts are centralized in big cities. What about, you mentioned there is a third dimension, so social aspect. What do you mean by that?
Yes, in the Japanese society, a female radiologist often has to give up work to support their young family. This contributes even more to the scarcity of radiologists. For these three reasons, I believe teleradiology is extremely relevant in Japan.
I see. So it makes sense because I guess your platform enables them to work part-time. Tell us how you approach teleradiology. Are you a service company? Are you a product company? What exactly are you focusing on?
MNES provides a response in two ways. On the one hand, MNES is a product company. Our product name is LookRec. On the other hand, MNES is a service company. These two complement each other.
So what exactly is the product?
Our product enables radiologists to provide reading services remotely to clinics. Here's a movie of how we use LookRec software to make diagnosis.
We have some technical issues. Just a second. Teleradiology platforms have their limits. Okay. Let me try refresh this maybe. Okay, we're going to live without it. So basically, there are two parts. One part is the reporting tool. The other part is the viewer tool. So the radiologist essentially inspects the images in the viewer and simultaneously creates the report. You can also select which slices you want to view, and you can manipulate the images in order to make the correct diagnosis. Let's see. So okay. So tell us a little bit about the service component, Kitamura-san.
MNES employs two types of radiologists. We have 11 full-time radiologists providing reading services using the LookRec platform to our partner clinics. We also have part-time radiologists to address changes in demand. We think of our platform as Uber for radiology to meet the dynamic market demand.
So I hope you're not going to start hiring Uber drivers for your teleradiologists. But tell us about who pays for the teleradiology service. Is it the patient pays, or is it the insurance company? How does that work in Japan?
We have customers for both options. All Japanese people have government healthcare plan, which covers for some radiology services. Some of our partners, for example, Ginza Clinic, offer direct-to-consumer imaging checkup, which includes a brain MRI plus interpretation, 3 experts, radiologists, cardiologists, and neuroradiologists, for less than $200.
So this was a shocking number for me when I heard this. So basically, Japanese are known to be very interested in health checkups. So there are private companies, direct to consumer, that offer a brain MRI scan for $200, completely paid by the customer, that offer a checkup by a radiologist, a neuroradiologist, and a cardiologist for aneurysms. So how does that make sense? Because this number, $200, is extremely low compared to the US, where a brain MRI can cost north of $2,000.
That's a complicated question. Let me offer 2 data points. A typical salary for a Japanese radiologist is around $120,000. Do you know what is the typical salary for US radiologists?
I think it's higher. So I want to reiterate the number. So I'm not a radiologist, but the numbers are like 3 or 4 times higher. $120K for a radiologist in Japan.
Another data point, malpractice insurance in Japan costs $600 a year. In the US, my understanding is that this number is much higher.
Does anyone actually know how much a malpractice for radiologists cost in a representative state?
So 10, 15 years ago, it was around $50,000.
$50,000, and it depends on state. It varies, depends on where you look, between 20 and 200K.
So I'm not sure about the other factors, but this definitely contribute to the cost.
Yeah, so I understand if you have your own radiologist, or if you don't have radiologists but you have imaging equipment, you can benefit from LookRec. How about clinics that don't even have imaging devices?
A very good question. For this case, we offer mobile CT service. Mobile CT is a dedicated truck loaded with a CT scanner. It helps us serve rural areas without a CT scanner. We drive this mobile CT to where it's needed and get people scanned. We also use it for employee screening, since Japanese law requires employers to offer this service to their employees once a year.
So this was a very interesting insight. So my team had the privilege of visiting MNES in Japan a couple of months ago. And we actually visited this van. We were inside this van. And Kitamura-san's technician offered us to run a presentation. So none of us wanted to volunteer for ionizing radiation. But we had the little anecdote I remember. So we had the little bento box lunch that the technician had that day. And he said that his wife made it for him. And he said, I don't know what's in it. I have not seen it. So he put it in the CT, and he scanned it. And we were able to figure out the rice and the little tamagoyaki. It was like lots of interesting insights.
So, sorry, by law, they have to get
So employers in Japan are required by law to offer annual checkup that includes a lung cancer screening. Very interesting difference.
They don't worry about those.
That's an interesting question. Yeah, I think there is a different approach to risk management in Japan. It was insightful for me as well. I think that they also try to striate patients, so they obviously you kind of have to hit the right demographics, and then it becomes more relevant. So, Kitamura-san, what is your vision for MNES in the future?
So far, I have been talking about tele-radiology model as it is now, but this is only our first step. In the future, I envision 3 steps. First, teleradiology. Second, image-based AI, algorithms that primarily look at the images for prediction AI. Third, holistic AI, algorithms that look at the other data, genomics, demographics, nutrition, for prediction.
I see. So I understand what image-based AI is. So you primarily look at images. Can you tell us like more specifics about how are you using AI?
Image diagnosis AI is algorithms that use images as primary data source. We have started working with different types of AI applications. Let me give you 3 examples we are already using today. AI that can detect brain aneurysm, which is abnormal blood vessel. Breast cancer is already used in daily clinical practice. CT lung nodule AI detector for cancer diagnostics. Interesting to note that the AI models have different quality. For example, AI for brain aneurysm detection has 85% sensitivity, which makes it a useful tool to double-check human radiologists. Let's play a movie to demonstrate how we are using AI in LookRec product.
So this was actually, before we play the movie, I want to point out that this was fascinating discovery because MNES is using AI algorithms already embedded in their clinical workflow. These algorithms are still in the process of clinical validation. But the specific algorithm, the brain aneurysm that Kimura-san mentioned, the breast cancer detection for MRI images, and the CT lung nodule detector. It was very interesting, especially to see the feedback collection piece, which you will see in a second. I hope there is sound on this one. No sound. Okay, so I'm gonna make a voiceover for this. So essentially what you see here, the pictures are being sent to the cloud. The AI detects what is the right algorithm. In this case, this is a brain aneurysm, and it detects that this is a brain MRI, so you have to apply the... And then the AI operates by detecting all the places where it suspects aneurysm to appear. All the results of the AI are here on the right side. And what the screen allows the radiologist to do is to provide feedback. So for each one of these findings, the radiologist has to say true positive, which means that AI was right, or it marks as false positive, which means that the AI was wrong. Once the feedback has collected, you can press send feedback, and that is being sent to the developer of the algorithm. Obviously, sometimes the AI misses things. So this is the false negatives. So this is an opportunity for the doctor to point and click where the AI missed the diagnosis. So this information is being used by the application developer in order to improve the algorithm continuously. So this is how the user invokes the AI. And this is the feedback screen again.
I use this AI system every day. Image diagnosis with AI would be the standard in the near future. But we radiologists should not rely too much on AI. If you trust AI completely and don't make diagnosis on your own, your diagnostic ability will decline in no time.
Present more. Thank you.
We should keep on upgrading our ability and send the diagnostic results to AI. That would improve AI's accuracy, therefore would be benefit for patients.
So, you know the loaded question, the elephant in the room. I don't know, any radiologists in the room? Okay, maybe no elephant here, but I can tell you when we give a similar talk in RSNA, which is the Radiology Society in North America, which is 30,000 radiologists getting in the middle of, in the winter in Chicago. The question is like, so what's going on here? Is AI going to replace radiologists? So Kitamura-san, what is your take on this?
This is indeed a loaded question. I know that there is a healthy debate in my professional radiology community. Here is what I think will happen in the near future. First, we will see that over time, AI will keep bringing more and more value as a decision support tool to help human radiologists make more precise decisions. Second, we know that human radiologists are valued for their experience. So we will help human radiologists focus on the truly difficult cases.
So one additional data point I would like to add is that the meme you hear in this space is that AI is not going to replace radiologists, but radiologists that are using AI will replace radiologists that are not using AI. Because it's like saying, okay, I'm not going to use the internet. But if this is a tool that allows you to be more productive and provide a better care for your patients, you are not competitive if you're not going to use it. Right? So another thing is to think about AI in this context. It's not one black box that solves all the problems of the world. Just like an autopilot in a plane is not one instrument. It is a collection. If you ever looked into a cockpit of a commercial airline, you know that it's a collection of instruments. Each one is very dedicated, very focused, and solves a very particular problem. Now, an autopilot is a collection, and they all work in tandem with each other, and they help the pilot make better decisions. The pilot is still the one who makes the final decisions, especially in the complicated cases like taking off, landing, or during turbulence. So the same thing, it is my view, that will happen in this space. We will see more and more tools, like the ones that Kitamura-san mentioned, developed and being helpful to radiologists to make them more productive. So I also think that there are a couple of questions that the whole space is trying to figure out, specifically around regulatory approval. How do you think about FDA approval of AI model that by definition is not fixed? You know, a medical device, fixed, you sign off the sheets, you manufacture it, and you're done. If you want to make a new device, you need to apply for regulatory approval again. AI, by definition, is something evolving. So FDA right now is also evolving in how it thinks about regulatory approval for AI applications. We actually work with the FDA closely in their program where they try to adjust their approach. Specifically, until now, the FDA has been focusing on providing regulatory approval to products. Now they're more experimenting with the idea that they can provide regulatory approval to a process. So if you're compliant with a process and they approve that process, it allows you to have more freedom to operate and experiment. Very exciting times. So Kitamura-san, thank you. These were great examples, I think, and the feedback collection piece, I think, is very interesting. Can you talk a little bit about holistic AI and your vision for that?
Holistic AI means using more than imaging data. We want to help patients collect different data types: medical record data, genomics data, nutrition data, medication data, exercise data, sleep data. Think of LookRec as Google Drive for medical records. Once this data is in the cloud, MNES AI can analyze it and make useful recommendations. We have already started a centralized management system, including medical interviews, medical care, and pathological imaging, in addition to radiologic imaging. To integrate those data, we use a Google account. Here in this room, some of you may have already started working on innovative AI applications. We are very interested to collaborate with partners to accelerate our mission. Please come talk to us.
So, Kitamura-san, until now you've been focusing on Japan. Are you only working in Japan? Are you thinking of going outside of the country?
Thank you, Ari. Your question has good timing. We are very interested to go global. Let me give an example. This month, we launched a collaborative project between Japan and Mongolia to help doctors in that country improve their radiologic diagnostic quality. The way it works is through the network system of MNES that connect the two countries. When diagnostic radiologists or pathologists in Mongolia face a difficult case, they can consult with experts based in Japan. It's similar to having senior doctors advising junior doctors in a teaching setting. This helps patients and also helps improve skills for Mongolian doctors.
Very interesting. So, Kitamura-san, you are now in Cloud Next. Tell us a little bit your cloud journey. Like, how did you end up choosing, why Google?
Many of our staff already use Google services, including Gmail, Calendar, and Drive. We wanted to build a tele-radiology as a service, as simple as logging into your Gmail account. Also, Google Drive is a place where people store their files. We want to build a place where people can store their medical images and data. We also wanted a partner of measurable size that would enable us to develop telemedicine services that would be reliable and scalable. We also have global goals, and we wanted a global partner. Most importantly, we saw Google as a partner with a vision that is aligned to ours. Democratize access to high-quality care universally. We see our goal achieved through telemedicine.
So it sounds like you had quite a checklist for your requirements. I'm happy that we were able to meet your expectations, Kitamura-san. Thank you. I wanted to ask you about some of the challenges around cloud. So in the US, we're learning that healthcare space, financial space, and other regulated industries like government, they're slowly warming up to the idea of using cloud for their data storage and processing. How is this happening in Japan? What kind of challenges were you facing when you were approaching healthcare providers?
We have indeed observed a gradual increase in willingness to use cloud solutions in the healthcare space, and we think it's very exciting. We think it has to do with two reasons. First, large financial institutions in Japan are moving to the cloud, and that sends a strong signal to other industries like healthcare. Second, because Japan produces so much imaging data, the cost efficiency of storing the data on premise becomes less and less economical for hospitals. They are looking for effective solutions, and here, cloud can provide real value.
Interesting. So when you're deploying LookRec, is it like a pure cloud or a hybrid approach? How does that work?
In the present, because many of our customers are asking for additional backup storage, we offer a hybrid solution. We keep most of the data in the data center in Tokyo, and some of the data on-premise in the hospital. We also know that Google is planning to open another data center in Osaka. This will enable us to move to a pure cloud solution, which will make our IT management easier.
Makes sense. So as we are about to wrap up, like what are you most excited about the future, Kitamura-san? What do you see the most opportunity here?
I'm excited about three things. First, I want to see MNES become a truly global initiative, bring specialist expertise where it's needed the most. Second, We want to advance the role of AI in teleradiology. We want to integrate more AI algorithms into our clinical work. Third, we want to find partners that can use our platform to solve problems like rare diseases. If any of these resonate with you, please come talk to us. We are welcoming potential collaboration. We would like to make our look like a tool that can improve patient lives. This is our mission, and nothing would make me happier than that.
Thank you, Kitamura-san. I think this is kind of, to wrap up, one of the examples of a very fruitful partnership, because LookRec brings a lot of the products that Google is building, showcasing what is possible to do with them. And it also enables other partners, the ones that develop the AI applications, to be tested, accelerated, and developed further. So this is an example of how Google Cloud is approaching the partner-first ecosystem in order to solve very specific challenges in the healthcare space.